how are you?
Hey, how was your Thanksgiving?
It was good. I just got back from visiting my grandma at the hospital, so good to see her. I will say I'm not feeling very good, so. Achoo!
Oh my god, why are the lights so bright? I don't feel so good. My neck is hurting. Oh my god, I feel like I'm about to be sick. No!
Oh my gosh, help us, we're
Doctor,
so sick,
please.
doctor!
Coming in, we're gonna try and figure out what's wrong. We'll get it all sorted out. What do you think it is? I'm not sure.
I think it could be bacterial meningitis because it's gram-negative, it's an obligate aerobe, and it also colonizes in the upper respiratory tract.
That makes a lot of sense, honestly, because it starts in the mucosal barrier and the nasopharynx in the upper respiratory system, and then goes into the bloodstream and enters the cerebral spinal fluid and the CNS. That makes a lot of sense because their symptoms include fever, headache, stiff neck, and they're also experiencing nausea and vomiting. Along with that, it being in their bloodstream, that can give them fever and chills. So I really think between the central nervous system symptoms and the bloodstream symptoms, this is probably it.
Agreed.
Okay, I'm so sorry. We think you have meningitis. We should probably get you on some masks and maybe some isolation. It's really pretty infectious between people, which is probably how y'all shared it to each other. It is kind of rare though. We see in 2021 like 4 in 100,000 people did get it. So I was just wondering, like, were y'all vaccinated around the age 12? Do you remember at all?
I wasn't.
I wasn't either.
Well, we do recommend that just because it is a pretty severe and acute disease. We can get y'all started on some antibiotics and vancomycin, and then we'll go from there. That's going to prevent it from keeping spreading and hopefully reduce that, all the symptoms. Y'all are probably going to have a hospital stay for a little bit. I'm so sorry, but y'all can be roomies here too. And, and in the future, maybe we get our vaccines if we can. The good thing is the mortality rate in the US in 2021 was only 0.3 per 100,000 people. So we got a really promising outlook. We're gonna get y'all situated and started with that strong antibiotic, and hopefully we'll see y'all better soon.
Thank you.
Thank you, doctor.
Bye, doctor.
I hate to see meningitis spreading again. It's a really serious one, and those symptoms are serious, and it doesn't survive a long time outside the body, but you know, it is really good at surviving and thriving and building colonies once it's in the body. So I really hate to see that going around.
Yeah, it's really scary, especially the ways it avoids immunity in the body.
Oh yeah, for sure. It's those bacteria are great at avoiding being killed by the complement system and avoiding destruction by phagocytosis, as well as they release a lot of endotoxins, which results in a lot of the symptoms we talked about earlier.
Yeah. Well, luckily we have some pretty good antibiotics. Our first one is vancomycin, which is used for penicillin-resistant bacteria. It basically inhibits the cell wall synthesis and blocks formation of peptidoglycans. And we also have ceftriaxone. It treats multiple bacteria and gram-negative organisms, and also inhibits transpeptidase enzymes and prevents the cross-linking of peptidoglycans.
I'm so glad we have those. I know they're super strong though. It'd be great if we got more people across the board getting that vaccine. I know that both of our patients today mentioned they hadn't had it. And across the board, that vaccine you get around when you're 11 or 12 really does a great job at preventing you getting it in the first place.
Yeah, definitely vaccines are super important. Another way they can prevent getting this disease is practicing good hygiene, so making sure they're washing their hands, covering their cough when they're sick. Also avoiding sharing drinks and utensils. I know they're roommates, so it's kind of habit, but definitely a good habit to try and get rid of. And then also just trying and seeking medical care if you are ever feeling any suspicious symptoms.
Yeah, I know she mentioned that she visited her grandma, so maybe that was the initial contact point. But hopefully you're not seeing this anymore from now on.
Yeah.
Thank you.